For the past couple of months, every time I get my period, the first day of my menstrual cycle, it is freaking insane. I experience like excruciating period pain, like to a point where like I can't function and my stomach is hurting so much that it makes me want to puke. Did I ever have bad period cramps? Yes. Did they ever make me want to faint? No. Now they do. So I'm like, why does it hurt so much? Like, I really feel it in my pelvic area, like I'm being stabbed over and over again. Okay, sorry for being a little graphic. It's just really bad. My theory, Dr. Nally here, kind of put 2 and 2 together. I feel like, you know, I've been taking tamoxifen for about over 1.5 years now, almost 2 years. And tamoxifen causes a lot of problems down there. If you watched my video on 5 side effects to expect on tamoxifen that I previously posted, you will understand what I've been going through. My gynecologist mentioned that it can cause the thickening of the uterus and, you know, second cancers like ovarian cancer and stuff like that, and that freaked me out. I thought period pain, tamoxifen, something must be up there. I pretty much addressed it with my oncologist, whom I still see once every 6 months. When I told him about it, he was like, oh, you know, tamoxifen doesn't really cause period pain. It's not part of the symptoms. That's what he sounds like, and that's what he said. I didn't believe it. I was like, I don't know, I just feel like, you know, my body is like crying every time it's having its period. So can we check what's going on down there despite it not being a common side effect? Can we, like, you know, can we just verify that everything's okay? So I pretty much demanded, yeah, I put my foot down and I was like, you doctor, give me an ultrasound. That's as aggressive as I get. I asked him if I could please get checked like more thoroughly, that I was a bit worried, and so he wrote me a referral paper to get a pelvic ultrasound. Let me ask you something, have you guys ever done a pelvic ultrasound? So I kind of regretted asking for a pelvic ultrasound when I showed up in the room, and then like the guy was like, yes, the guy, I repeat, a male, was like, hold on, this is like a pelvic ultrasound. Okay. I'm exaggerating. All to say, there's like this dildo looking stick of a camera that the dude is holding. It is inserted inside your vajayjay, and at the top of the probe is a camera, and that is how he sees inside your pelvic area. Ovaries to the right, ovaries to the left, and you're just there like, okay, what do you see? Do you see anything? The doctor was looking inside me, and then he took a few screenshots with his computer. As soon as that was over, he left me. Yes, he left me there with the probe inside me. So he was like, let me just go see with my boss and show him the images and ask him, you know, his opinion. And so he just like left me there with the probe inside me, because he was saying, oh yeah, it's best that it's not removed, because then I gotta go like wash everything and disinfect anything in case I need to use it again. So yeah, I was just like sitting there with like this thing inside me, like just waiting. It was so awkward. So awkward. Okay, so when he came back, this is what happened. He started off by giving me good news, and he was like, oh, Natalie, you know what? Your uterus and your ovaries look normal. They don't even look like they were ever, you know, that you ever did treatment or anything. Like, everything looks great. And I was like, ah, but, oh, really? Are you really going to add a but? Yeah, so he did. And he's like, but on the right side, we found a hemorrhagic cyst. Now, if you know me, you know that I don't know what a hemorrhagic cyst is. I don't even know if I'm saying it properly right now. I don't know any of these medical terms. I just don't like the sound of finding something that's like a cyst in my body, because that is what they thought was in my breast, and it wasn't cyst, it was cancer. I kind of flipped out. But then right after he told me it was a hemorrhagic cyst, he told me, don't worry, it is benign and it's common and it happens with a lot of women, mostly premenopausal women, but since you're taking tamoxifen, it's kind of like you're premenopausal. And he just went on by explaining that it wasn't dangerous and it's just something my body needs to get rid of in the next 8 cycles of my period. He said that I just, like what my oncologist said, he said you should just take a Tylenol. I was like, okay, thanks. But otherwise, my uterus and my ovaries are fine, according to the guy who did the pelvic ultrasound. Now I just gotta wait for my oncologist. But you know what they say, no news is good news. So if I don't update you anytime soon about this, it's a good thing. So today's lesson and the point of this video is, if ever you have any concerns about what's going on in your body, don't be scared to ask your doctor. Put your foot down. You are your own health advocate. No one knows your body better than you. If ever you feel like something's wrong, demand for some tests. But don't be scared, even though it's kind of scary. It's always going to be scary, but it's best to know. Let's just leave it there. If you've experienced any side effects like excruciating period pain on the very first day as well, let me know by commenting below. I would really appreciate it. Also, don't forget to check out chemosecrets.ca. I just released my first e-guide, tips, tricks, and real-life experiences from a young breast cancer survivor. It breaks the ice for other women who are about to start chemotherapy. So if you know anyone who's about to start chemo, or you are about to start chemotherapy yourself, pick up my guide. I really worked extremely hard on it, and it's kind of like how I'm talking to you right now. That's exactly how it's written, so I think you would really like it. Go check it out at chemosecrets.ca. Be patient, be kind to yourself. Bye. Natalie, let me just check your ovary to the left. Okay. Oh, let me check your ovary to the right. Okay.